Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello, and welcome to this week's episode of the podcast. It's great to have you along as always. Thank you to all of you that have been giving us some fantastic feedback on the podcast. It's really appreciated, and it's a lot of fun bringing these to you. Today, we're talking about a topic that is very, very hot right now in social media. It is a very topical issue right now when it comes to dermatologic and aesthetic treatments, and that is the whole topic of exosomes. You may have seen these on social media. People are sharing posts about having treatments with exosomes, but the truth is I don't think that there's a very good understanding about what these actually are and how these work. So today we're going to tackle this. We're going to talk about what exosomes are. We're going to talk about how they're created and, of course, what they do. How do they function? How can they help when it comes to medicine and your skin, dermatological procedures, treatments, and aesthetic medicine treatments as well. So let's get into this and let's define what these exosomes are, first of all. This is going to take you back to biology 11, 12. All right, if you are a biologist or you have a scientific mind, then some of these terms will be familiar with you. If not, it may be a while since you've heard these terms, but I'm going to break it down for you so it's really simple. Exosomes, essentially, are nano-sized extracellular vesicles that are released by the majority of cell types. Okay, so as I said, there's a lot of fancy terms in there. Let's break that down. So first of all, at a very basic level, we are living organisms. Plants are living organisms. What are living organisms made up of? Of course, we are made up of cells, millions and billions of cells. And the cells function to have us, hopefully, function in a healthy and efficient manner. But cells have to be able to communicate with each other. They don't just exist in isolation from each other. They need to communicate. And there are lots of different ways that cells can communicate. But one of the ways that they can communicate is by creating small little vesicles, small little containers, if you will, almost like a microscopic balloon that has some type of protein or biological material in it. And the cell will give off these vesicles, and then those can move outside of the cell to another place, perhaps to an adjacent cell or somewhere else. And then that is one way that one cell can communicate or send a message to another cell. You can think of these little vesicles as almost like your Amazon Prime delivery guy. It's taking a package from one cell to the next with some very important protein inside this package that is then being used to communicate some type of message to help cells function in a more efficient or a more healthy way. So that's what the vesicle is. The word extracellular, as I mentioned, simply refers to the fact that these vesicles are outside the cell. As I mentioned, the cell gives these off and then they travel from one place to another. So these are parcels of biologic material that are no longer in the cell, but has been given up by the cell and is now moving somewhere else. And nano-sized, well, of course, that refers to the size. These things are tiny. When you think of a nanometer is 1/billionth of a meter. Okay, 1/billionth of a meter. When you think about a piece of paper, a thickness of a piece of paper is 100,000 nanometers thick. So when we're talking about nano-sized particles, we are talking about extremely small particles. In fact, when you think about it, the cell has given off the particle. So this vesicle is actually much smaller than the cell itself. It's just a tiny percentage of what the cell has created. So that's really what exosomes are. They are these extracellular vesicles that have been released by cells, and they contain some type of protein. And they have a very, very important role when communicating between cells and having the target cells react in some way. Why is this so interesting to us now? Well, the thing is, we have started to understand that the biological processes that are guided by the exosomes have very important roles when it comes to disease states and the health of our skin. The exosomes can be derived from various living organisms, whether it's a type of animal or whether it is often a plant cell that is used. But here's the thing, because it's a vesicle and it's not actually the cell itself, the exosome is not living. It's not a living organism on its own. It's just a piece of a package that has been sent out by a cell. And that means that these can be cleaned, they can be purified, they can be harvested, and they can be concentrated so that we can then use them for medical purposes. And that's one of the really exciting and tremendously powerful benefits of the exosomes. Furthermore, because they can be concentrated, they can then be stored and they can be transported. And that allows us to essentially package them and have them available in clinics for us to use. And that's one of the really impressive and very crucial elements to the use of exosomes in a clinical setting. Okay, so now we've talked about what they are and the fact that we're able to store them and manipulate them and have them available for clinical use. That brings us to the question, what are the clinical uses of exosomes? Why do we have these? How are they helpful to us? Well, the first thing I'll say, and I'm not going to get into this a lot here, is that there have been some studies that have already been done that show that they have a role in cardiovascular disease and myocardial infarctions or heart attacks and reperfusion injuries. Basically, a whole bunch of medical terminology for saying that they have actually been shown to have a role in a number of disease states, and the use of these can be beneficial in helping to treat these disease states or prevent these disease states. Now, more research is being done in this area, and it's very preliminary, but nevertheless, it's very, very exciting. Having said that, today we're going to focus on a little bit more of the dermatological and aesthetic uses for the exosomes. Now, in order for us to be able to use these for our skin, they have to be able to get into the skin. And again, here is one of the real benefits of exosomes. As I mentioned, exosomes are tiny. They are nanoparticles, and they have been measured to be between 30 and 200 nanometers. So that's 30 to 200 billionths of a meter. And again, remember, they are smaller than an actual cell. That means that these particles, these vesicles, these exosomes can penetrate your skin because they can fit between gaps in cells. And that means that when we apply them to the skin, they can actually penetrate and get down to have a beneficial effect on our skin cells themselves. Okay, so now let's move on to a couple of the key uses for the exosomes when it comes to our skin. I'm going to cover a couple of these. I'm going to cover a little bit about eczema, sometimes known as atopic dermatitis. We're going to cover the use of exosomes for scarring. We're going to cover the use of exosomes for hair loss, for pigmentation, and for skin aging. Let's get right into it. Let's talk about atopic dermatitis or eczema. First of all, eczema is a chronic skin condition where there is some inflammation, and it can, in some cases, have a significant impact on the quality of life of people with the eczema. It causes redness, it causes very itchy skin, it can cause flaking, people have a tendency to scratch it, and it can be quite troublesome for some people in particular. It has been shown that exosomes, particular types of exosomes, can decrease the immune response that is happening in our bodies that causes the eczema. Without getting too much into the details and the specific proteins that are involved, the bottom line is that the exosomes are capable of reducing the inflammation in the skin. In the case of eczema, the exosomes also have the ability to improve the barrier of the skin. And this is also part of the complicating factors of eczema that can lead to the irritation of the skin. So, again, in summary, the exosomes have been shown to decrease the inflammatory response in eczema and improve the outcome for those suffering with this condition. Very exciting stuff. Let's talk about scarring. So first of all, scarring can unfortunately have a detrimental effect when it comes to the psychological well-being of a person. And so many people are often looking for ways to get rid of scarring. Now, there are different treatments that you can do for scarring, whether it is chemical peels, whether it is lasers, and that sort of thing. And those are very effective. But the nice thing about exosomes is that they can actually be used in conjunction with that. Now, some of the preliminary studies with exosomes show that they promote the migration and the proliferation of the cells that repair tissue, the fibroblasts, and the collagen deposition, the way the collagen is laid down in a way that facilitates the wound healing process so that you get less scarring. In conjunction with, for example, a CO2 laser, some other type of laser, the exosomes have been shown to result in a shorter recovery time and fewer side effects of the laser treatment. So the exosomes, in conjunction with another treatment, works very well. That's in fact one of the things that we do at the anti-aging clinic. There is the option that if you're coming in for a Secret Pro a CO2 laser treatment, that you can then have exosomes placed on top of that or even before it to help promote the healing of the laser, getting you better recovery, quicker recovery, and more effective results. So that's a really exciting area for exosomes as well. Now let's move on and talk a little bit about exosomes and hair loss. What do they do there? Well, similar to the issue with scarring, for some people, hair loss can be quite psychologically distressing. And as a result of that, many different treatments have been developed to help with the hair loss. Some of these include oral medication, some of these include microneedling or PRP treatments, and some of these more recent treatments include the Alma-TED, which is the machine that we have at anti-aging. Now, some studies show that exosomes have a role as well when it comes to hair loss. Some of these early studies have shown that using exosomes has the ability to stimulate the hair follicles to proliferate and to accelerate the anagen phase, which is the growth phase of our hair. In fact, some studies looked at the objective measurement of the thickness of the hair, and they did find that there was some improvement with the use of exosomes. Now, as with all other studies with the exosomes, we're still in the early phases, but this is very, very encouraging. And again, this is something that if you want to learn more about, we're happy to discuss that with you, specifically the use of exosomes for hair loss, another very exciting area for aesthetic treatments. Now let's talk about pigmentation, or changes in the color of the skin. A very common hyperpigmentation disorder is known as melasma, and that is observed as irregular light brown to dark spots or patches on the skin, particularly on the exposed areas of the face. And there have been a number of treatments that have been developed to deal with this issue. Interestingly, exosomes appear to have a role in treating this as well. Once again, early studies are looking very promising, but they are early. What is believed to be happening is that the exosomes contain proteins that function in the way the keratinocytes and the melanocytes, or the cells in your skin that control the color of your skin, function. Put a different way, exosomes have an impact on the way that your skin is colored through the proteins that they contain. And as a result, it appears that exosomes could have a role in treating hyperpigmentation or irregular spots on the skin. Another very exciting and promising area with exosome treatment. Finally, let's talk about skin aging. As we all know, we all age. There's no way of getting around that. But there are things that we can do to help our skin maintain that healthy glow, that healthy, vibrant look that we all would love to have forever, if at all possible. Skin aging is a very complex process. There are some things that we can control. For example, being out in the sun a lot is something that we could control. And there are other things that we can't control, more about our genetics and the way our skin ages. But what's exciting about the exosomes is that some of the preliminary studies show that they can help with the synthesis of collagen, or the protein that helps to give us that vibrant, elastic type of skin. There's also some early studies that suggest that the exosomes can help reduce the damage from UV exposure. And so while the studies are early, again, there's a lot of promise here with the exosomes when it comes to skin aging as well. So as you can see, exosomes, while early on in the research, there are many, many studies going on, and there's a lot of excitement about the exosomes. And I think that is for good reason. There is a lot of promise in all of these areas that we talked about, in addition to other areas. Again, when it comes to atopic dermatitis or eczema, when it comes to scarring, when it comes to hair loss, when it comes to hyperpigmentation, and when it comes to skin aging, these are all areas that exosomes appear to have a beneficial role. If you are interested in learning more about exosomes, please feel free to contact us at Anti-Aging. We have many different types of treatments that we can now offer in conjunction with exosomes if that is something that you want to pursue. It's a very exciting area of aesthetic medicine. We are thrilled to be able to be on the forefront of this as well, to be able to offer this. And as I continue to learn myself more about exosomes and continue to read the new research papers as they come out, I will be sure to share this with you as well on the podcast as we hear of new uses and new research that shows us more evidence of the exosome uses when it comes to aesthetic medicine. Thank you once again for tuning into the podcast. I hope this was fun for you. I hope it was nice to be able to learn a little bit more about exosomes. As always, feel free to reach out to me. I'm only too happy to have a chat with you about anything that you've heard about on the podcast. On Instagram, I'm Dr. Teri Fisher, DrTerifisher. Feel free to reach out to me at Anti-Aging Vancouver as well, at antiagingvancouver.com, or on my personal website at drterifisher.com. Until next time, be well, and talk to you soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.